I'm Dr. Deuk, and I'm here with one of my patients who had the Deuk laser disc repair on November 4th. And he came from California because he had a herniated disc in his thoracic spine, which has been giving him pain right by the shoulder blade on that right side, just down below it, for 4 years now, right? Or was
Yes, sir, 4 years.
4 years. And you just had the surgery literally an hour and a half ago. How do you feel?
I feel wonderful. I feel it's life-changing, actually. The pain was so constant and the discomfort was so constant, particularly standing, and with my job, I experienced it most of the time. So this is fantastic. Thank you.
Yeah. So he's on no pain medications right now, other than what he normally takes. And when you took your pain medicines before you came to Deuk Spine, did the pain medicines get rid of that pain you had up here or not?
No.
So they kind of eased it a bit, but they never got rid of it?
No, and I've had 3 epidurals and some other procedures prior to this, so it only provided temporary relief.
The epidurals did. But
yes.
The pain medicine that you took today, like you normally do, it never took the pain away?
No.
No, you could always feel it. Now,
yes.
Do you still feel the pain there?
No.
The pain you came with?
I don't.
It's gone?
It's gone. I feel where you put the tube.
Yeah, of course.
Of course.
It's going to hurt for a day.
Absolutely. But no, I don't feel it. It's quite remarkable.
Congratulations.
Hey, thank you so much for your time and help.
You're welcome. Your thoracic disc pain is gone. So I know you have another one a little lower, which maybe someday we'll get a chance to fix it.
Sure.
So.
Absolutely. Can't thank you enough, and appreciate everything you guys do.
You're welcome. Just tell the audience briefly, how hard was it for you to find us, and how long did you look, and what did you try? I mean, it must have been a journey for you to get here.
Sure. Gosh, I saw 5 doctors in the Southern California area. One doctor charged me $1,000, looked at my MRI and said there's nothing that we can do for you. That was quite sad. I've had 3 epidural shots, rhizotomy, pain medications off and on, which did not seem to get rid of the pain. So very easy to find Dr. Deuk. I actually looked up on YouTube different exercises that might help relieve my thoracic pain, and Dr. Deuk's videos came up, and I did a little bit more research, and I thought, gosh, why isn't everybody doing this? And then I talked to Joe, and I said, Joe, it's so interesting that doctors talk to you and they look at you like you have some sort of life-threatening disease because they can't fix. And I thought, well, this is America. Somebody has to be able to help. And so that's when we moved forward. And so just grateful. Thank you.
Yeah, just an hour and a half out of surgery and the pain is gone from the thoracic disc that you've had for over 4 years.
Yeah.
And I see you moving your body like,
I know,
is it really gone?
Yeah,
That's
and the nurses told me not to twist and turn, so I'm
you can do a little bit.
Trying
not
not to,
problem,
but yeah.
Not a problem. Yeah, so the medicine we gave you for your surgery is propofol. And propofol is not a painkiller. It never takes pain away. And it's already out of your system because you've been here recovering for a while. And you've already had lunch?
I did, yes.
You had some Wendy's?
I had some Wendy's. The nurses were kind enough to share.
Yeah.
So, and they've been awesome. Fantastic care.
Thank you so much. All right, anything else you want to say to the audience before we wrap this up?
No, I would just say if you're thinking about it and you have the opportunity, I highly recommend it, and just very grateful. So thank you.
You're welcome.
Thank you, sir.
And I can't wait for you to see your surgery.
Absolutely.
It went really, really well.
I downloaded the app, so I'm looking forward to it.
Yeah, we didn't have a single hitch, and we'll give you a little zip drive with your surgery tomorrow.
Fantastic.
When you come back in.
Thank you, sir.
All right, we'll see you tomorrow.
Appreciate it.